My name is Kristin McDonald. I'm a family nurse practitioner here at Shawnee Health in Marion. I've been here for about a year and a half. Prior to that, I spent 10 years at Memorial in the ICU, and about 5 years before that in the Chicago suburbs working cardiovascular care. I was born in Harrisburg, which is not a thing that happens anymore. Babies are not born there. And I grew up in Equality, which is a very small town until I was about 8 years old. We relocated to the Chicago suburbs, and I lived in Joliet until about 11 years ago. Me and my husband moved down here for him to finish school and just decided to never leave. My husband and I, he is my high school sweetheart. We've been dating since I was 15. And then I have two daughters. I have a 7-year-old and a 9-year-old that keep us very busy. If I'm not here, you will find me likely taking my children to their activities. When my husband came back to finish his degree, I think initially we intended on going back to the Chicago suburbs when he finished, but he found a wonderful job here in the area, and I loved the work that I was doing at the hospital at the time. I hadn't gone back to school yet, and I was pregnant. And we really enjoyed the slower pace of living, the nicer crowd of people, a lot less traffic, the beauty that surrounds us. And I decided that I wanted to work at Shawnee because I was amazed by the work that I saw when I was here for clinicals. There's so many resources available, and our case management works tirelessly to make sure that people have the things that they need. And I really enjoy that we look at people as a whole and not just prescribing their medicine, but making sure that they have food, their housing is appropriate, and that they have someone to talk to when there's a problem. So I really enjoy that we take care of the whole person instead of just one portion. I love the challenge of diabetes because it's one of those things that medications help, but a lot of times lifestyle changes are needed. But it's also one of those things that when you get good control, it's a lot of fun to celebrate. So I really like to be able to celebrate those small victories with my patients, that they've made the changes necessary to help their health and prevent complications. I really enjoy getting to meet new patients and look at areas where we can improve not only their health, but just their overall well-being. And I enjoy when patients come back saying that they feel better from whatever it is that we did, whether that be a medication or just some counseling, or just making sure that they have the things that they need. So one of the things that I really appreciate at Shawnee is that, especially as a newer nurse practitioner, I'm only a year and a half into practice and still have some areas where I need to learn. We have resources available to care for the entire patient. So if I have a women's health problem, I can refer someone down the hall. If I have a patient that I just can't seem to get their psychiatric medications where they need to be, we have psychiatry services available. We have counseling. Just about everything that you could need is within our organization, and even if it's not a referral, I'm able to reach out to experts in their field and be able to ask questions and learn more along the way.